Good morning, everybody. Thank you for joining us this morning for today's Intermountain Healthcare Community COVID update. We appreciate you joining with us on our Facebook page, and we also appreciate the journalists who are joining us by Zoom for today's update and press briefing. We're pleased to be joined by Dr. Brandon Webb, an infectious disease physician here at Intermountain Healthcare. Dr. Webb, thank you so much for joining with us today.
Thanks, Jess. Good morning.
It has been a couple of weeks since we held this update, so we have a lot to cover. We're going to jump right into it. As always, just some of the ground rules. We invite the journalists who are on the Zoom call to submit any questions they have in the chat, and we'll make sure those are presented to Dr. Webb. Also, those who are joining us on our Intermountain Healthcare Facebook page, we invite you to ask your questions as well for Dr. Webb, and we'll ensure that those questions are answered during the next half hour or so that we have the time with Dr. Webb. So we're going to go ahead and get started. A lot to cover. Brandon, thank you so much for being here. We know how much you have going on and how busy you are. Let's begin with a quick update. Where are we in terms of community transmission levels and hospitalizations? Kind of give an overview of where we are as of this morning.
Absolutely. You know, it's interesting. We're actually in a near mirror image of where we were going into Thanksgiving last year, both in terms of our case counts and our hospitalization rates. Overall in the state, our hospital capacity and our occupancy with COVID-19 patients is at a very high level, and it's at a level that was similar to what we saw going into the winter surge last year. That's both good and bad. It's good from the standpoint of planning. We unfortunately know what we're in for. We know what to expect looking forward. And obviously it's unfortunate from the standpoint of having to maintain access to provide care for all different types of conditions. One thing that's very different this year compared to last season is that we are already seeing a tremendous number of other respiratory viruses. We have high rates of RSV. The croup viruses are also at high prevalence in our community, and we're starting to see some influenza now. So all of those cause severe disease in certain patients and can also lead to hospitalization and secondary pneumonia. So we're actually anticipating that because of that nuance this season, we are poised to have higher pressures on our healthcare systems in general.
Yeah, looking at the data, Utah still remains among the top 10 in the nation, among the states for high COVID cases. We continue to see a little bit of a beltway in the Intermountain West region. What do you attribute that to? Is it the ongoing seasonal change? What are your thoughts on that?
Let's actually talk about that pattern, because we're actually seeing now really kind of two distinct patterns in the epidemiology of COVID, state by state. There are a number of states who had a very meteoric surge early in the summer as Delta just ripped through primarily the unvaccinated populations, causing a really dramatic spike in cases. We saw that in a number of the southeastern states, where case counts actually exceeded the peak case counts from any time previously during the pandemic. That pattern, that epidemiologic pattern, is a very cautionary tale, because with those very high case counts come very high hospitalization rates, and unfortunately death rates correlate very closely with community transmission. And what we saw, unfortunately, throughout the summer in especially the southern states was very high transmission in the community and very high death rates. In some places, in a 4-month period, matching the normal annual average mortality rate that we would expect in a very compressed time period. That's excess deaths. Those are lives lost, and each one of those is a tragedy. By contrast, we're also seeing a pattern in a number of other states with a flatter curve, if you will. Still too many cases, of course, but a more stable trajectory. And that's what we're seeing right now in Utah. We have high case counts, but we haven't seen that spike. And as a cautionary tale, we do not want to get in that position where we get into logarithmic growth, where the spike really accelerates, because that very quickly overwhelms the resources that are already right at capacity, and it leads to preventable deaths. And I think as a state, that's a very laudable goal for us going into the winter season, is do everything we can to protect vulnerable lives, to maintain healthcare access, and to avoid getting into that spike situation. The irony, I suppose, is that in those cases, those states that spiked, those are now the cases that have largely burned through their vulnerable population, but at a terrible cost. And so they do have lower case counts than we do currently, but it's not been a favorable public health strategy to just burn through the susceptibles. There are much safer ways to manage transmission, and I think Utah so far is in that more favorable category, and I'd like to see it stay that way.
Yeah, as we look at the data, and I'm looking at it from yesterday's report from the Department of Health, we're starting to see daily double-digit numbers in deaths, as you refer to. We're just under 3,500 total deaths in Utah since the pandemic began. We're at 3,457. Does that concern you that we're starting to see an uptick in those double-digit deaths? And we're also seeing relatively ranges of 1,100 to 1,400 daily new cases. Is that where you expect we are? And again, what concerns you as we head into the winter months, which are on our doorstep?
Yeah, all of these lives lost, but also livelihoods. I think that there's a significant economic impact that's more difficult to measure. We're seeing a lot of work days lost, a lot of absenteeism, both from work and school, and those metrics also impact our economy. They impact families and the ability to maintain livelihood. And of course, the lives lost are tragic, and we are anxious to do whatever we can to decrease that rate. Unfortunately, that death rate correlates very closely with community transmission. And we've been working closely with the Utah Department of Health and other healthcare systems to really understand who it is that is succumbing to COVID-19. And, it's interesting, the makeup of the composition of patients that are unfortunately passing away from COVID right now. About 80% have chosen not to be vaccinated. About 20% are vaccinated and have vaccine breakthrough infection. In that group who have vaccine breakthrough infection and ultimately pass away from COVID-19, there's a very high rate of medical complexity. Those patients have, on average, at least 4 or more different chronic medical conditions like asthma or emphysema, diabetes, obesity, heart disease. And a significant number of them have immune systems that are compromised. So up to a fifth of those deaths in the vaccine breakthrough group are immunocompromised patients who can't respond well to the vaccine. On the other hand, the 4/5 of the patients who die of COVID right now and are unvaccinated tend to have fewer of those medical complexities, but obesity is a big one. So really taking a step back, for me, the big takeaway point from what we're experiencing in terms of life lost is we really need people to understand their risk and their risk factors. If you have chronic medical conditions or have a body mass index of over 30 and are an adult of working age or older, you are at higher risk of having severe COVID, hospitalization, ventilation, or death. That's the reality. And it's that population that we really feel strongly about advocating for vaccination. The benefits of vaccination in patients with high risk far outweigh the rare side effects that have been observed with vaccination.
With that knowledge, we are today one of the highest travel days in America during the year. We have gatherings that will be occurring tomorrow for Thanksgiving. What guidance can you offer people to try to stay as safe as possible in the next, this rest of this week, and then as we head into the remainder of the holiday season? What advice would you give?
Yeah. One of the most important things that folks can do to protect themselves and their loved ones during the holiday season is to recognize that there is a significant overlap in the symptoms of COVID-19 and the symptoms of the many other respiratory viruses that are now circulating. And really what we want to message is test early and test frequently. We have lots of testing access available, and we can't afford to follow the pattern that we've traditionally followed, where if you get the sniffles or kind of feel off, you let it run its course, see how you do. It's really important to get tested, see if you have COVID-19. Individuals who've been vaccinated and do have breakthrough COVID-19 tend to have more upper respiratory symptoms like runny nose, sore throat to begin with. And there are a number of other viruses in the community that cause very similar symptoms. And so my message and encouragement going into the holidays is one of accessing testing frequently. If you or your kids or your loved ones are starting to develop, symptoms of upper respiratory infection, go get a COVID test. Find out if you have COVID-19 and then make wise decisions from there. If you're sick, stay home. Stay away from individuals who could have severe disease or death from COVID-19. And remember that in addition to COVID, there are a lot of sick kids in primary children's and other hospitals with RSV. The croup viruses are also severe. Adenovirus is in the community. So this sort of message of taking responsibility for one's own health, but also for those around you whom you love, by staying home if you do have symptoms. If you get sick, make the wise choice, get tested, and stay away from others.
A question from Jed Bull at KSL News. If you're fully vaxxed, what precautions should you take for gatherings tomorrow? How safe are you? And should you take additional precautions when gathering, with extended family?
I think every family needs to think about their family makeup and the risk and the individuals who are going to be there. I think the first thing families ought to do is really kind of set that expectation that if you have sick family members, sit this one out. We'll bring you some turkey at home. It's more important than having transmission within the family, especially to those who are at higher risk for severe disease. We are very grateful for how effective the vaccines are, but we recognize that in individuals who do have chronic medical conditions and those who are older, the vaccine effectiveness is tremendous for preventing hospitalization, but less protective for breakthrough infection. And so I think it's important, again, to know your risk, know who's in your family, and plan those gatherings accordingly. If you have the flexibility, it's best to meet in well-ventilated areas. It's great to limit the amount of group size where possible. And again, when we're talking about doing things out in public, patients who are at higher risk should make choices about Black Friday shopping. There's a lot of online options. So my message is know who's in your family, know what their risks are. Individuals who've been fully vaccinated, but it was last winter, really should be getting the booster now. If you're eligible for the booster, which all adults who have been more than 6 months from their second dose are now eligible, should get the booster shot, because that really will help us with decreasing those breakthrough infections.
Yeah, this is our second Thanksgiving holiday season within the pandemic. Is it just a reality of our environment now that as we are still in the pandemic and the holiday season upon us, is that families just have those conversations and they talk about what precautions need to be taken, who needs to be protected, what their risks are? Is that what you'd recommend?
Yeah, I think those open conversations go a long way. A lot of times it's the concept of, well, I have the sniffles, but I'm going to just see how things go. And then I associate with others. And it's actually during that first couple of days of symptoms when the virus is at the highest level in the body and most contagious. So again, just emphasizing while having those conversations, the concept of early testing, early test access, and then sitting one out if you do have symptoms, because it's an investment that's worth making to sit one out and to protect a loved one who may be at high risk.
Lisa Riley Roche from the Desert News asks, what about masking for both the vaccinated and the unvaccinated at Thanksgiving gatherings tomorrow? What's your recommendations regarding masking?
Mask guidelines remain in place, and they reflect the fact that a large proportion of the community who are carrying COVID-19 are pre-symptomatic and then develop symptoms, are unvaccinated, and a fraction of the individuals who are positive or will go on to be positive for COVID-19 are breakthrough infections. So the CDC mask requirement or recommendation, I should say, reflects that and encourages mask wearing in indoor settings where social distancing is not feasible. In settings where we're dining, wearing masks consistently is not possible. And so I think finding locations for having Thanksgiving dinner where distancing is possible, finding places where good ventilation is a possibility is important, where masks are not as compatible with having dinner. And again, limiting those groups is really important as well.
What's the current state of hospitals now as we head into the winter months? Where are we at in terms of volumes, capacity levels, those types of things?
In the Intermountain system right now, our major COVID hospitals are all above 100%. So I should take a step back. We're at 97.8% of our ICU capacity, with several of our large hospitals well above capacity. We're at a level of COVID occupancy that is right at the peak, the record number of COVID patients in the hospital that we saw in early December last year. So we are bursting at the seams. We've never had more COVID patients in the hospital than we do now. The hospitals are flexing everywhere they can. We have a lot of travel nurses who are helping out with the staffing shortage. And we are recognizing more and more that as caregivers, as healthcare providers also get symptoms of respiratory infections, it takes them out of the pool. So staffing continues to be a big issue in our hospitals.
What are your thoughts on where we're at as a state with the vaccination rollout? It looks like the current data shows that we're here in the state of Utah, we're about 63% of Utahns have at least one vaccine dose, and about 55% roughly are fully vaxxed. So a little bit over half the population. From an epidemiological standpoint, where are we at and where do we need to be at to really move forward?
Remember, achieving immunity at the community level is the number one goal for exiting the pandemic in some way. And so we're recognizing that vaccine uptake has actually increased over the last couple of weeks. We're up 10% in some population demographics. that 5 to 12-year-old age group, we're actually up more than 10% over the last couple of weeks, and that's going to help with our community immunity as well. We're seeing more uptake in booster doses, and that's all encouraging. I can't emphasize it enough. The more vaccination we get at the community level, the more likely it is that we return quickly to lower levels of transmission like we had last spring, and are able to enjoy more normalcy and prevent loss of life and economic impact. So, we're not at a place right now where we have enough community immunity to prevent transmission at high levels or to prevent the emergence of new variants. And it's really important that we create that buffer, that blockade, so that we don't continue to generate new variants in our population. So, to answer your question, we really do need to be at a much higher level. We're looking at other locations around the world who have achieved 80% or higher, and their death rates plummeted. So, for example, the Netherlands, they are at almost 84% vaccination right now, and have had over the summer very, very low hospitalization and death rates. That's where we want to get. We are recognizing that natural immunity can be acquired both by vaccination and by having the COVID-19 infection itself. We want to recognize that both wane over time. And so individuals who've had COVID-19 should still consider getting vaccinated. It puts them in the best possible position from a protection standpoint, both in terms of the duration of their immunity, but also in the breadth of their protection against new variants.
Is your hope that we will have higher vaccination rates? Are we at a point, again, I hear that those who've been vaccinated, who are willing to be vaccinated, want to be vaccinated, have been vaccinated, and those who are choosing not to likely will not. We're continuing to see an increase. Yesterday, there was an increase of about 3,000 vaccinations, including within that 5 to 18 age group. But is your hope that we are going to be able to move that needle higher, or are we roughly where we're going to be at and going to have to cope with this during this pandemic?
I'm still very hopeful. I think we're seeing individuals who were reasonable and wanted to see additional data before making that decision, or they needed to talk to their physician about specific considerations around vaccination, and have had those conversations and are now making the choice to be vaccinated. And I think now with the experience that we've had, we can say very confidently that for the vast majority of individuals, COVID vaccine products are available that can be given and minimize risk and maximize benefit. And again, even for the lower risk groups, who I think people recognize that for lower risk groups, the benefit of vaccination personally is lower than in the higher risk groups. But at the community level, the benefit of vaccination in those lower risk groups is substantial. It prevents hospitalization, death, and community transmission, and also has a really important economic benefit as well.
A question from KSL News Radio: how long after a vaccinated person experiences breakthrough infection should they avoid contact with others? And if there's a positive test 3 or 4 weeks ago, should they skip the family gathering tomorrow for Thanksgiving?
The period of contagiousness hasn't changed. So for individuals who develop symptoms by 9 days or 10 days after the symptom onset, the individual is no longer contagious unless they are immunocompromised or have had severe disease, severe enough that they needed to be hospitalized. Those two groups do tend to have a longer window of contagiousness. But if you're at day 10 or greater from the first day of symptoms, and your fevers are gone, you are no longer contagious.
And we'll kind of wrap this up today, Brandon, with more of a personal question for you. But tomorrow's Thanksgiving is a time of gratitude. As you've gone through nearly 20 months of this pandemic, and you've worked side by side with nurses, technicians, pharmacists, therapists on the front lines of this major challenge in our lives, can you reflect on your gratitude? What you pulled out of this experience that continues to happen, but where are you today in terms of your perspective on that?
Yeah, I appreciate you asking. I'm actually on call in the hospital this week, so I'll be in the hospital with my colleagues across the board, nurses, respiratory technologists, pharmacists, other physicians. I'm very grateful for, the personal sacrifices that have been made in the healthcare industry to continue to do everything we can. But I'm also very grateful for the support that we've had from the community. I'm grateful for individuals who've chosen to do things that they would prefer not to do because it protects others and it protects themselves. And I think that personal sacrifice is something that is difficult for all of us, and it's been heartwarming to see people, really lean into this. And I really still believe that as a community, we have a pathway through the pandemic that minimizes the loss of life and loss of livelihoods. I think that, in Utah, we can continue to lead out in doing the right thing, doing things that protect not only ourselves, but also others. And other things that I'm very grateful for, Jess, I'm very grateful for accurate information. I think that that's been such a struggle for us during the pandemic. And I'm grateful for good quality research and the great minds around the world that have been helping us rapidly learn about this virus. I appreciate the knowledge that we've gained in both how to prevent, but also how to treat this terrible disease. So I appreciate the personal touch there. I think that we've got a lot to be grateful for. We're certainly in a better position than we were last winter. We've got vaccines that are available widely. We have testing that's available widely. We have new treatments that continue to evolve. And we have the tools as a community to get through this winter season while minimizing the loss of life and economic impact of this terrible disease.
Well, again, we thank you. We appreciate your time, and especially this week. We hope you'll be safe. We know you'll be away from your family in the hospital taking care of others, so we appreciate that. A big thank you to all the journalists. I see a lot of familiar names on the call today who we interact with on a daily basis, who do a really nice job of reporting and trying to inform the community and doing so in an accurate and informed way. And so we thank them and wish them a happy Thanksgiving. And then for everybody who's joining us on our Facebook page, to those families and individuals, we wish you a safe and happy Thanksgiving holiday. We hope we can get through this challenging time, but we appreciate all that you do. So with that, we'll go ahead and end today's update. For the journalists on the call, we will send out a link to today's briefing along with some additional content and resources. And we wish everybody a safe and happy Thanksgiving. Thank you so much for joining us, and we'll see you next time.